The World Health Organization estimates that each year approximately 1 million people take their own life. That's one death every 40 seconds. Experts predicted numbers would peak in 2020, but no one could have imagined the devastation brought on by COVID 19. During the coronavirus pandemic, you may experience anxiety, sadness, and loneliness. Existing mental health conditions, including severe anxiety and major depression, may worsen. If you're feeling hopeless, contemplating self harm, or you're concerned about someone else, I'm here to tell you there is hope. A Mission for Michael is dedicated to helping clients achieve complete inner and outer transformation. Mission for Michael is the premier resource for intensive mental health treatment in Southern California. With an astonishing 2-to-1 client to staff ratio, each client in their facility receives individual care 24 hours a day, overseen by a team of all doctorate or master's level clinicians. With a focus on evidence-based treatment, along with personalized and compassionate care, they offer mental health treatment that can change lives. If you're suffering from mental illness or you're concerned about a loved one, go to amfmtreatment.com. Again, that's a mission for Michael, amfmtreatment.com, or call 866-581-4401. Again, that is 866-581-4401.
Hey, everyone. It's a dose of Dr. Drew.
It is. We have a very special guest. I've asked to return Dr. Kelly Victory. There you are. Welcome back. Is it sufficient to just say ER and public health specialist?
Exactly. Totally sufficient.
Fair enough. I've usually given the details out, but today I'm just going to give you that because I'm not going to hold you too long. Just a couple things I wanted to get into, and I really appreciate you coming back. Vitamin D appears to be in the zeitgeist all of a sudden again, and I want to get your thoughts on that. But go ahead. Where do we start that conversation even?
Well, vitamin D is one of the many vitamins and minerals that's important to overall health and the functioning of your immune system.
For sure.
So, we know that always during cold and flu seasons, you're well advised to be supplementing things like vitamin C and zinc and vitamin D and others. What's interesting here is that there have been some really credible studies that
See, it's not just your dogs. It's not just your dogs.
Now I feel better. I feel better. There are some studies that have linked vitamin D deficiency to an increased risk of both being diagnosed with COVID-19, but more importantly, with having a bad outcome from COVID-19.
Right.
And this is very interesting.
Well, that's what I'm already confused at that point because early on I heard correlation coming out between probability of being infected or having high rates of infectivity and low rates of vitamin D in the population. Then more recently, my understanding is that the primary thing seems to be you're less likely to get bad COVID if you're vitamin D replete. Would that be a fair way of saying it?
Yes, it is. And what we don't know, Drew, is really which came first. We know that we have the vast majority, frankly, of Americans are deficient in vitamin D. It's very, very common. Certainly more common in patients who are Hispanic or African American, or people who live in those climates, those northern climates where they don't get as much exposure to sun. But vitamin D deficiency is extremely common, and most people should have their vitamin D levels checked just routinely on an annual basis to see where they are and to see if they should be repleting vitamin D regularly, totally independent of COVID. But you're right. Now there's been this connection between vitamin D and deficiency and bad outcomes, and they are tying it, and we can get into this, to that whole inflammatory process that goes on with some people who get COVID-19, that overreaction of the inflammation system that causes people to develop all of these bad side effects, from the fluid in the lungs to blood clots, different tissue damage of the heart muscle, for example, of the kidneys, related to that cytokine storm that we've spoken about previously.
Right. Now, I've been, really focusing on the tumor necrosis factors, the interleukins, the CCL5 and RANTES system, and somewhere recently, in like last week or two, the renin-angiotensin system and the bradykinin system suddenly became the popular target. And there's a connection between vitamin D and bradykinin, I guess. Is that correct?
Yes, and bradykinin is one of those things that modulates some of the inflammation processes that happen. Right. So if we can control, bradykinins is one of the cytokines that causes this inflammation. And inflammation isn't always bad, but it sure as heck is bad when it spins out of control, because it causes that cascade of things, including clotting of blood where it shouldn't clot, different damage to cells that cause, in the heart muscle, for example, people hear reports of myocarditis, inflammation of heart cells. So those sorts of things. So the bradykinin component seems to be significant and is downregulated by vitamin D. In other words, if you have adequate vitamin D on board, you are less likely to have this bradykinin storm that starts causing some of the downstream ill effects.
Right. And even if it's not bradykinin that's the primary mechanism, it's again another piece of evidence that the vitamin D, where we think it's doing something.
Yes.
And will we all agree that everyone should probably take 5,000 units of vitamin D right now?
Yes, I think, the average, the RDA for vitamin D is relatively low. It's between, 400 and 800 IUs. Most people can easily tolerate closer to 1,000 to 4,000 international units. And I would recommend doing that. Yeah. As I said, because so many people are deficient. Now, the best thing you can do is actually go to your doctor and get a vitamin D level done so that we aren't just shooting in the dark. Right. But one of the things that's interesting, though, is if this is true, if vitamin D deficiency is one thing that might lead you to have a worse outcome, that would explain part of the reason why African Americans and Latinos have had a worse course with COVID-19. Yep. That's in addition to the fact that there is a higher incidence of some comorbidities like obesity and diabetes in that population. But vitamin D deficiency by itself might be part of the answer to that question. In terms of getting the blood tested by your doctor, there's a once a week prescription 125 dihydroxyvitamin D that can really highly supplement the D if you're not coming up to where you need to be with just the usual over-the-counter oral supplements, which is very common. Right. And people need to remember, though, Americans tend to think if some is good, more is better. That's not the case necessarily with vitamins. So you do have to be careful. Vitamin D is one of the vitamins that's actually fat soluble, meaning it dissolves in the fat in our bodies. So vitamins K, A, D, and E are fat soluble. And as a result, you can actually overdose on them. You can take too much, where vitamin C, which is not fat soluble, you cannot overdose on vitamin C because you just excrete any extra in your urine. But vitamin D, just because some is good, doesn't mean that you should go out and buy a bunch of bottles of vitamin D and pop them like candy. You should do it with some caution.
Right. And then, of course, the zinc story is we talked about last time. Personally, I'm taking quercetin and zinc. I think that's a reasonable thing to do.
I do too. Susan. I think zinc is always, the flu season, I always replete zinc.
Susan, you have a question? Oh, here we go. By quercetin. I'm a 60-year-old male. Restarted a vitamin supplement of quercetin, zinc 50 milligrams, vitamin C 1,000, vitamin D 5,000. What other supplements should I add to my regimen? I think that zinc is a little high. You might want to go to 25 milligrams on that. And again, we were just talking about vitamin D. Discuss with your doctor because you can take too much of that.
Yeah, and selenium's another one I happen to like. People tend to be low in selenium. Most multivitamins have a trace amount of selenium, which is all you really need. But make sure you're taking something that contains selenium because it's not easily found in the diet.
Now, the other thing I wanted to talk to you about was another correlation I'm seeing, which is I'm trying to figure out, I'm curious where you're at with this. I'm looking at a study from the Washington Post right now. It's not a study, it's an article. And it's correlating, it's trying to make the case, trying to scare people. It's part of the panic porn, trying to scare people that opening restaurants is going to create another surge. And there's some pretty interesting charts I'll just describe to you that show that there's a correlation between not restaurants being open, but bars being open and the subsequent summer escalation we saw. Are you worried about restaurants opening indoors? I'm not that worried about that. And And not only that, of course, they leave out the fact that there was a lot of other things going on right exactly at that same time. So these correlation studies are always nefarious.
Yeah, I have precisely zero concern about bars, restaurants, movie theaters reopening. I truly do. We know that the lockdown has not been effective in stemming the impact of COVID-19. We have plenty of experience in looking for other countries, whether it's Sweden or Korea or Japan, other places that did not do these draconian lockdowns have ended up with the same number of deaths per million people as we did here in the United States. And they managed to do it without having this profound impact, not only on the economic status here, but psychosocially and everything else, shutting down of schools. So
Right.
no, I don't have concern about that. We know that we've had, huge protests of people who are not wearing masks, and we haven't seen a tremendous fallout. The bottom line with this, Drew, remains that COVID-19 is a risk to a very small portion of the population.
In terms of dying or bad outcomes.
Yes,
Yeah.
in terms of dying or bad outcomes. So it does not present a significant risk to the vast majority of people. And we know who those people are. It's not a question. This is not something that's changed horses in the middle of the stream. It's not like at one point it was attacking elderly people, and now all of a sudden, healthy 30-year-olds are succumbing to it. That simply isn't the case. We know who the risk category is, and we can rally around and protect that small group of people. So if I were a 75-year-old with obesity and diabetes and heart disease, I might choose not to go to a bar or restaurant just yet. But I believe that the rest of us are absolutely able to do that without significant risk of becoming, meaningfully ill.
So it seems like the concern is the R naught of this thing, the infectivity, and that there's a sense that it's going to spiral out of control and then get into the at-risk populations, and as well take down some people on the way that are in younger populations, which is a rare event. But if it's on a large scale, of course, that's a lot of numbers all of a sudden. Or is it just the case that this thing has a certain run rate, as it were? Is it that living with this virus has a certain potential for penetrating the population? It did it over the summer, and now it's going to go to sort of a low boil for a while, almost no matter what we do. Is one of those possibly what you're seeing?
It's exactly what I think. The latter is exactly. I think, all viruses like these respiratory viruses run the same trajectory. If you look at the curve of every single respiratory viral outbreak, pandemic or otherwise, they all have precisely the same curve, whether or not you do lockdowns.
Right.
They all eventually, flattening the curve happens naturally. That's what always happens in a pandemic, whether we lock down, socially distance, wear masks or not, because the people who are at the greatest risk become ill and succumb early on. So you get the big peak. And then over time, the curve will flatten naturally if you do nothing at all, precisely as they have proven in places like Japan or Sweden. Now, what's going to happen, I predict, as part of this fear fest, is that we are now just about getting ready to run head on into influenza season. And we are going to have the very predictable uptick of respiratory viruses like we do every October. So what's going to happen, I fear, is that you're going to have more people who come down with, upper respiratory symptoms, fevers, cough, those sorts of things that are identical to the presenting symptoms of COVID-19. And it's going to be very unclear. And people are going to say, oh my gosh, see, we told you so. You open those bars and restaurants and lo and behold, everybody's sick. When in fact, many of these, a large number of them, will actually be coming down with other coronaviruses, common colds that typically start to uptick in the fall, and influenza.
Right. And as it pertains to other coronaviruses, other common colds, I'm trying to figure out the T cell story here. And the simplest way I can describe it to people out there is that your immune system may have seen other coronaviruses that it remembers and may confer to you a certain amount of immunity against this coronavirus. Is there the whole story about T helper 1 and T helper 2 and which pool is remaining? I get confused every time I start reading about that. Do you have any simple way of thinking about that?
Well, the way I think about it in general is just that T cells are the very first line of defense, and that they happen way before your immune system ever gets around to forming antibodies. The very first line of defense are those T cells.
Yeah.
It appears with COVID-19, and frankly, with a lot of coronaviruses, that people simply fend them off without ever developing antibodies.
Right.
It's likely why children don't ever become significantly ill with COVID-19 and don't develop antibodies, because their T cells are so darn good at simply wiping the virus out on the front side before they ever get to that point.
Right.
So they don't have antibodies, but they haven't needed them because they can eliminate it. And I think this also explains, Drew, why when you are exposed to things a lot, which I believe we are supposed to be, and that's part of the downside, I believe, of social distancing and perpetual mask wearing, is that it sort of, dulls your immune system. You may recall, I'm sure your experience was the same as most people in medicine, that in those early years, in your early clinical years, you got sick constantly because you're constantly being exposed to people with lots of different viruses and colds, and you get sick all the time. And then over years, over the first year or two, all of a sudden that doesn't happen anymore. Your average pediatrician who sees 50 or 60 or 70 patients on a weekly basis, kids in their office, doesn't come down with a lot of stuff because their T cells are just really, jazzed up, for lack of a better term. They're on the ready.
They should do a limited study on pediatricians, see if they have any added T cell immunity
exactly.
against coronavirus.
Because I just think because their immune systems are just primed and ready to fight off these viruses when they come along.
Well, it's going to be interesting. It seems like the next couple months of this thing, I mean, I guess we'll have a vaccine pretty soon, but it will kind of tell us, it will answer that question of, is moving about, is going to restaurants really a risk or not? We actually should know within a few weeks, at least in some states, right?
Yeah, with regard, by the way, to the vaccine, the issue with the vaccine, or one of the issues, in my estimation, is that it hasn't been tested well enough to know, assuming it causes you, the host, to create antibodies to COVID-19, we have no idea yet how long those antibodies are likely to stick around. So say it turns out that you do in fact develop antibodies to this vaccine, but they only stick around for 3 months or 6 months. Does that mean that then I assume that we will need people to be vaccinated every 3 months or 6 months? Which becomes a bit absurd. So I think it's too early to say whether or not a vaccine, if they're actually able to get one over the finish line, if they do, whether or not that will be really meaningful in stemming the spread of this if the antibodies aren't prolonged.
And most of the vaccines I've been reading about, the real response doesn't occur until they get the second vaccine. And I'm not sure how much time is between the first and the second, which is kind of interesting.
Yeah, generally somewhere between 30 and 90 days. That's what they're studying. Yeah. And you're right. It's meant to be a 1-2 punch so far with the COVID-19 vaccines.
Now, Chris is asking, is vitamin D referenced in the recent 76 patient study something that can be considered legit? There's lots of legit studies on vitamin D, lots of them. They're correlation studies and what appear to be, I wouldn't call them gold standards, but decent studies on the relationship with vitamin D and some mechanisms of action that have been suggested. So it's a story that's still being played out, but I wouldn't assume it's going to prevent infection. I think that's a mistake to think about it that way.
Okay. I agree. I don't think it'll prevent it, but I'd say there's zero downside in my viewpoint of actually, taking some vitamin D supplements, particularly because so many people are deficient.
And Susan, don't you have a mask question up there?
Oh yeah.
And also, I'm worried about the mask and flu, because flu is hand transmitted, and if we're putting our hands up on our face, that's going to add to the flu transmission.
from Twitter.
And this is another question. I'll let Dr. Victory answer this one. Teen daughter gets cold sores on her mouth since starting school and having one. She has more. Is that spreading from the mask wearing all day? She's miserable. It also makes me wonder whether it's really not a virus, but impetigo, which really would spread all over the place.
And we are seeing so much of that.
Of impetigo?
Of impetigo. We're seeing a tremendous amount of what I would fall under the general topic of mask dermatitis, meaning rashes or infections around the nose and mouth. The most common one is impetigo, which is commonly a strep bacterial infection, which normally you would never see in adults. It's primarily in young children, but we're seeing it now because that mask, number one, it keeps a moist, wet, warm environment, which is perfect for the spread of bacteria. Number two, people touch their noses and mouths much more commonly. And you start to do what I fear is happening if this child that was referenced in the question, in fact, has a cold sore, which is generally viral, sometimes herpetic, sometimes other viruses, but you can auto-inoculate. In other words, you spread it from one spot to the next. You can spread it to your eye. You can spread it to elsewhere on your body. And because people are wearing masks all the time, and number one, they tend to drink less, people are becoming sort of chronically dehydrated during masking. Nobody's applying lip balm the way they normally do, so people's lips are cracked. They become very dry, and it's easy then to auto-inoculate. In other words, take virus that's over here and spread it to a crack in your lip over here. And so there is an element of auto-inoculation that's happening with some of these viruses and bacteria.
Right, makes perfect sense. And then again, I think we were both saying that our hands, this is why people were saying there was a sort of a consensus against masks to begin with, because we were all reared on the idea that our hands are our primary transmitter of viruses. This one happens to be primarily droplet driven. You were tweeting yesterday about droplets. What was that about?
I was. Well, people unfortunately say, well, there's no way a mask could work because the virus is teeny tiny and the pores in the masks are bigger than that. So they're saying they believe that the reason masks don't work is because of the size of the virus. Masks don't work, but not for that reason. Masks don't work because the virus isn't just flying through the air by itself. It's traveling on something, what we call a fomite or a vector. It's traveling on a respiratory droplet. So although you're correct, the virus particles are very tiny and by themselves could get through the pores in the mask, they aren't traveling on their own. They're being carried on a droplet, a respiratory droplet of saliva or that's been exhaled, and that could theoretically be caught in the mask. The issue is that the masks they're not designed for that. We tend to breathe around the sides of the mask. You'll notice these masks are not tight. They're not respirators. They are simply meant to keep me from inadvertently spitting or coughing into a wound, or to keep me from being splashed in the face as a physician, being splashed with blood or other bodily fluids. We breathe generally around the sides, and so the virus is going in and out, particularly when these are worn out in the environment. If you wear a mask, a surgical mask in the operating room or in a hospital setting, those are climate controlled. They are higher oxygen environments. There isn't a lot of dust and particulate matter flying around an operating room. Those things, when you're walking down the street, there's dust and pollen and smog particles and everything else that very quickly clogs the pores of that mask. So you end up just breathing around the sides and up from the bottom. So you're sucking in viral particles from wherever they are on those droplets.
I'm looking at Fauci's comments from, I guess, late last week. He's saying that about 40 to 45% are asymptomatic now, which probably reflects, again, a lot of the stuff we've been talking about, and that it's largely young people that are around this thing. So, again, it's sort of hard to understand why we wouldn't be just working on mitigation and living with this thing. I mean, H1N1 was not a lot, it was not as effective as this and didn't kill quite as many people, but nearly, and people don't even know that thing happened. That's what I keep saying. It's like, man, I mean, if you were 40 years old, you were much more likely to die of H1N1 than COVID.
No kidding. And I would suggest, with regard to Dr. Fauci saying that 40 to 45% of people are asymptomatic, I would say it's more like 80 or 85%. When he says 40 to 45%, he's saying 40 to 45% of people who get tested are asymptomatic. There are a whole heck of a lot of people out there who are asymptomatic who know well enough not to go get tested or who aren't getting tested.
Right.
There, I guarantee you, are plenty of people out there walking around who've had COVID-19 or have it currently, have it in their nose and mouth, but are fighting it off, are asymptomatic with it, and we simply aren't going to get ill. So when Dr. Fauci says 40 to 45% are asymptomatic, he means of people who are going in and getting tested. There are lots more people who have it. And that's the point. We just need to go out and protect that small group of people who really are at risk. And we know who they are, thankfully. We know who those folks are. As you said, back with H1N1, or God forbid, the Spanish flu back in 1918,
Right.
that struck and took out people in the prime of their lives.
Right.
You know, the primary target then was healthy people between 19 and 49.
And so if you had a magic wand and you could conduct the world, at least the United States, the way you think it ought to be conducted, what would it look like?
Honestly, Drew, I would go back as quickly as possible to what I consider the old normal. I eschew the concept of even the phrase, the new normal. The old normal was just fine. This is not the first virus that's come down the pike. It won't be the last one. We need to undertake reasonable mitigation procedures, which means, for example, maybe we continue to have an hour in the morning at places like, the grocery store or Trader Joe's, where those older folks can go and not have to interface with the throngs. That's a lovely concept and makes sense. Maybe we can have home delivery services for people who are in those, risk categories for groceries, or curbside pickup. Those are some nice and reasonable things to implement. But the idea of the masses wearing masks, staying home, the closure of schools, these things need to end, and they need to end immediately, because they are simply not based on science. They are not sustainable. And the damage we are doing to millions and millions of people by those closures will far, far outweigh the damage from the virus itself.
And by damage, you're meaning economic damage, mental health damage, substance use, overdoses, suicide, depression, anxiety,
and physical. And physical.
Delay in treatment because you're nervous about So I agree. I think it's going to be much. Although apparently, I haven't seen the data lately, but apparently our excess mortality rate has come back to essentially below baseline right now, which suggests that whatever is going on there is not adding to our excess mortality just yet.
Well, we've now at least done things like reopen. The moratorium that was on elective surgeries has ended.
Yeah.
People are going back and now getting, things like getting mammograms, getting colonoscopies, getting those screening things. But we won't know for a while really what the impact of that's going to be. But there's no question that just if you look simply at the economic devastation and associated depression, substance abuse, suicides as a result just of that economic component, that by itself is enough reason to say, stop this madness.
And yet it goes on, so it seems, and it's become a source of virtue signaling. How dare you say anything approximating what you've just said, Dr. Victory?
Exactly.
Because that means you hate old people and you want old people to die. I know that's your intent, right? That's your goal.
Well, here's a question from somebody that, maybe we should answer.
Okay. So why the hell am I covering my nose? Droplets are exploding out of other people's noses to mine. That's the theory. The nose is the main transmitter and receiver of the droplets.
How come you didn't say, come on, dog?
No, I had that. It's funny. I had a conversation about that today when I was wearing the mask over just my mouth because it's the only way I can get into the grocery store. And someone said to me, please, over your nose. And I thought, for Lord, I am not blowing my nose on you. The risk to having my nose uncovered is to me, not to you. The risk of having my mouth uncovered, you could claim, is to you, not to me. But it is silliness to try to cover your nose and think that you are protecting somebody else, unless you are somehow blowing your, out your nose.
Sneezing, maybe. Something like that.
Which I doubt is happening. God, I hope that's not happening.
And isn't it interesting now that countries that had completely locked down, like Israel and certain parts of Europe, that when they start to open up again, the virus just gets going again. So there's a certain amount of this virus we have to kind of get through the population until we get the vaccine, right?
Well, it's the idea. Whenever I hear somebody say until we eliminate this vaccine, I think, let's remember, we have only eliminated a handful of viruses in the history of mankind.
Oh, this one's going to be around forever.
Smallpox being one of them.
Yeah.
This isn't going to be one. We are not going to, eliminate COVID-19. It's simply people will develop immunity to it. Most people don't get ill from it. And we have to recall that every single year, people die from influenza. Certain years, like the H1N1 year, we have a lot of deaths in people. Mm-hmm. But generally, people's risk in those things has been far greater. H1N1 was far greater than it has been from COVID-19.
Well, Kelly, I just thank you for stopping by. I just want to get into that vitamin D thing and talk a little bit more about some of these issues that are been thinking about. And I realized I never asked you what your sort of world would look like if you could open it up again.
It would go back to the old normal.
And then if there were outbreaks, would you have localized kinds of measures or anything?
No, I think unless you are seeing significant pressure on the healthcare system, which was a legitimate concern in the first days, maybe the first week of this whole thing, it was a legitimate concern to say, whoa, we got to be careful. This thing could spin out of control and we could have an onslaught on our hospitals. And it makes sense to keep some powder dry, to say, let's put a moratorium, for example, on anything elective. Let's free up some beds. That makes good sense. But very, very quickly, Drew, we knew that that wasn't the case. So unless you are seeing the kind of outbreak that is causing unbelievable pressure on your healthcare system, and you really are not able to spread that out amongst other community hospitals, then no, I don't believe in a shutdown. I don't believe in, masks simply are not indicated. You can wear them to virtue signal, but the science is simply not behind it. And this idea of social distancing, as I've said, again, that is not a construct that's been tested or tried in public health. I have a library full of books on public health, epidemiology, and virology, and the term social distancing does not appear in any of them.
And so your opinion is the surge we had this summer was the result of all the congregations, the large congregations, and that and then it just ran its course.
And the surge was also related to random testing of asymptomatic people. If a bunch of asymptomatic people, for all we know, we've had a pandemic, quote unquote, of influenza every year. We just didn't know about it because asymptomatic people don't get tested for it. It would be tantamount to my saying, I feel great, I'm on my way to the gym, I have nary a symptom, but I think I'll stop on by my doctor's office and get a quick test for strep throat.
Right.
Your doctor would look at you like, why would I do that? That's ridiculous. We don't test asymptomatic people for something because we don't even know what to do with that information. Yet with COVID-19, we have tested hand over fist millions of people and then used those, quote, positive cases to drive healthcare policy or public health policy, and that is patently absurd.
Right. We have not, a case could be an asymptomatic carrier, could be just a piece of viral RNA that's not even related to just happened to be on the nasal surface of that individual.
Correct.
Which is going to be around forever. It's going to be around forever that way.
And that's why I believe we've seen the quote uptick, because
an arm just came into the picture.
Hold on, Susan. I got one last comment, then I'll let Dr. Minter go. Is that one of the things that I find a little frustrating is no one ever expected to reduce deaths from COVID. If you remember, the original intent was to prevent the healthcare system from being overwhelmed, so we didn't have excess deaths from people not being able to get healthcare. No one ever imagined they could really impact the death rate of this illness. And the thinking that you can is probably a fool's errand. So in places where they stomped it down, it's going to come right back again. Am I right about that?
Yeah, yes, the virus itself is going to come back. Fortunately, we actually have discovered, we have, gotten better at our way of treating this. We absolutely know more about how to help people and how early we need to treat people.
Yes.
It's not only hydroxychloroquine and zinc, but it's things like inhaled steroids. It's things like repleting vitamin D, taking quercetin as a prophylactic, those sorts of things. We know that we should not wait until people are significantly ill to initiate treatment, those sorts of things. So in fact, we actually have decreased the death from it, primarily because we've gotten better.
So by keeping it as low as possible while we learn how to treat it, we're probably impacting the death rate that way, right?
Yes.
But we're not affecting the death rate by affecting the spread of virus. That was never the intention. Right. I think people get very confused about that. No one states that. Just think back to the very beginning. Flatten the curve, flatten the curve, flatten the curve. Not reduce cases or eliminate deaths. Flatten the curve. And that is a specific goal, because that's the only goal we could achieve, which we did. We did it rather readily. All right.
We did it a long time ago. Today marks the week 27 of 2 weeks to flatten the curve.
Yeah, right. It's very funny.
Dr. Kelly, people are asking if you practice.
I do. I do. I don't have a hospital-based trauma and emergency medicine practice any longer. I teach. I spend a lot of my time teaching on mass casualty response, preparedness and response, and I teach a course on leadership in times of crisis. But I still see patients 2 or 3 days a week.
And let me ask a couple questions from the thread here. Laura says, you were still that I am a big proponent of masks. I still am, but Dr. Victory is drilling holes in my I have no problem wearing a mask. So I'm going to keep doing. It's one of these no harm, no fouls thing for me. So I'm going to keep doing it. And
I respect that. I respect anybody's.
This is how we move things forward. And then somebody, let me get this. Wait, there was somebody had a really good question. So he's asking it this way, and I don't think I think you would reframe the question, but he says, what is Dr. Kelly's bottom line method to kill corona?
You mean if you're infected with it, or?
Well,
or
I think that's the point. Is it's not a viable question. We can't kill coronavirus. It's going to be around with us forever, even when we're vaccinated. It's going to be around.
If someone became ill with it, if the question was, what would you do if you got coronavirus and all of a sudden had a fever of 102 and started to develop some upper respiratory, I would take hydroxychloroquine, zinc, and azithromycin. And we've had unbelievably remarkable response with that. I meet on a weekly basis with hundreds of physicians via video, hundreds of physicians from around the country to swap stories and hear what kind of success people are having. So if you're asking what I personally would do if I became ill with it, is I would start to take hydroxychloroquine, zinc, and azithromycin.
And I would add steroids in at some point in the course. I really think we haven't figured out the timing on that yet, or the dose, or which type of steroid, but I think that's going to be a big deal. We know for sure it's a big deal in later disease, but I think it might have something to do with
I agree.
The people that get the cytokine storm, I got a feeling. And then, of course, if you want to learn more, Dr. Yohendra and I did multiple pods on all the different other research that's being done to modulate. Look at the one with Dr. Patterson and myself and Dr. Yo. We really get into the weeds of cytokine storm. Dr. Victory, I'm going to let you go.
Thank you so much.
Where should people follow you?
Well, they can follow me on Twitter, which is my primary social media outlet, Twitter, at Dr. Kelly Victory. And I also have a YouTube channel where I post a number of videos, including this one will end up there. And if you go to my YouTube channel, it's Victory Health Inc. There are several Victory Healths, but I'm Victory Health Inc. And I post videos until at least they get censored and taken down.
All right, we'll talk to you soon. Good luck.
Take care.
Take care, you too.